Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power. And today's topic is on smoking cessation. And bringing us this great information is Dr. Sharon Allen, a researcher on smoking cessation, exercise, and relaxation from the University of Minnesota. Welcome, Dr. Allen.
Thank you, Tina. Thank you so much for inviting me to come.
I am so delighted that you could come and educate my viewers. I mean, that is one of the hardest things to do, is to quit smoking.
Right. That's very true.
Yeah.
It's a very hard thing to do. And we work with the smokers as always and try to help them quit.
Right. And that's such a great goal, because you know that they'll get a better quality of life.
Absolutely,
Right.
absolutely.
But
right.
this is your first time on Knowledge for Wellness, and I
Yes.
really would like you to take a few minutes to introduce yourself to my viewers.
Okay.
Let them know about yourself and your love, your passion, and working at the University of Minnesota.
Thank you. Well, I've been at the university for over 20 years.
Okay.
And I've been working in tobacco cessation and women in particular for that time period. And I also am a professor and teach the medical students. I have a very definite passion for women's health.
Mm-hmm.
And so I teach them about women's health, and I also work in the women's health clinic at the university. And I have a specific interest in bone health for women.
Okay. That sounds wonderful. And, you know, with all of the research out there now, and, you know, the statistics with the Surgeon General explaining to us, you know, that it is a cause of cancer. So I know that you're here to help the women to quit smoking, and also you can be here to help a male that also has a loved one that may be smoking. So we kind of target a really good audience here today.
Wonderful,
Yeah.
wonderful, great.
So I'd like first, of course, for you to introduce, you know, what smoking cessation is all about.
Well, it's about quitting.
Mm-hmm.
It's about not giving up. It's about, in particular, women. Mm-hmm. That my focus is, and we have found that women really have a harder time quitting.
Yes.
There are several reasons for this. They don't seem to have enough confidence in their ability to quit. Mm-hmm. They seem to have more negative affect or depressive symptoms, and when they try to quit, those symptoms surface, mm-hmm. and then it makes it harder for them to quit.
Right.
So, and they also have weight concerns that
yes.
are more than what men have when they quit. And so those are some issues that make it somewhat harder for women to quit.
Mm-hmm. Yeah, I actually had a girlfriend who quit smoking. We were so proud of her, mm-hmm. but she gained 15 pounds.
Wow.
So
yeah.
she went back to smoking. You
Yeah.
know, and it's sort of the root of all evil, to expect to maybe gain a few pounds, but
Right.
then to get it into maybe an exercise program or something of that, to kind of know that you be healthy, maybe not in a month or two, but down the road in maybe 6 months as well.
Right.
Yeah.
Yeah, women and men too do gain weight
Mm-hmm.
just because of the lack of the metabolic effect of nicotine. They gain anywhere from 6 to 8 pounds, but there are stories of women gaining a lot more, and you're right. Exercise is just a definite benefit in trying to keep some of that weight off, and it has many other benefits too.
Yeah.
So,
Well, we can talk about the benefits, of course, about, you know, the bone health, because
Right.
I don't think a lot of people, if you were to take an x-ray from inside of the body and how much that really hurts, you know, a female's bone, then you're talking about osteoporosis and,
Right.
you know, just kind of how you degrade, you know, each level that smoking does occur. So let's just touch base real quick on that.
well, smoking affects the bone health because it actually affects the estrogen levels.
Mm-hmm.
And estrogen is important in keeping our bones healthy.
Right.
And that's why when women become postmenopausal, they lose more of their bone because the estrogen is gone. And when you have a smoker, they actually, this is an anti-estrogen effect, and so they have lower estrogen all along, and then as they come into menopause, they have even lower estrogen. So and we also really don't know what the toxic byproducts of combustion of the cigarette causes for bone health either.
Yeah.
But we do know about the estrogen. So there's several reasons why smoking is bad for the skeleton and for the bones.
Yeah. Especially during menopause as well.
Right,
Yeah.
right, because they'll naturally lose some bone at that point, but even being a smoker, it'll be even more exaggerated.
Yeah, wow. And so the estrogen, how it combines, there's not really a definite amount or scientific proof as yet on the research that's been done on that?
Well, there is more on the estrogen, but on the toxic byproducts, the combustion byproducts of smoking, they probably have a negative effect on bone health too. Bone health is a balance between building the bone and resorbing the bone.
Sure.
And in a young woman, that process is going on in a very balanced manner. And then when women get into menopause, it becomes unbalanced. The estrogen's lost and the resorption of the bone becomes greater. And the smoking, actually making less estrogen there, accentuates that whole process.
Yeah.
So these women who smoke never really get a really good bone mass even when they're younger, and so they even start with lesser bone mass as they become menopausal.
Yeah, because a lot of women that started smoking when they were younger have just continued.
Right.
You know, it's become part of their lives that they really can't even think to quit smoking, and like you said, just has deteriorated a lot. Yeah.
Right. Right.
So we should talk basically about, you mentioned exercise, of course.
Right.
You know, we're not making someone go out and probably exercise an hour a day at all. Maybe you're just talking about, you know, walking or, you know, something on that level. But
Right.
how is it that, you know, exercise helps in the quitting of smoking?
Well, we have studies that show that exercise actually helps decrease some of that craving when women try to quit.
Okay.
And that it's very beneficial in terms of making your bones healthier. That impact of walking or cross-country skiing or jogging, but even just walking, just a little bit of walking every day is really very beneficial for the bone.
Sure. Like when you go out to get your mail, maybe walk around the block a little bit.
Yeah,
Something
I
like
tell my patients that start slow and increase it and do it a couple times a day, you know, 10 minutes 3 times a day, and try and increase it. Even 10 minutes a day to start, anything.
Yeah.
Anything to get people to start exercising.
Yeah. And maybe they'll get
yeah.
addicted to that feeling, that great feeling
Yeah,
when they get
those
back at it.
endorphins,
Yes.
yeah, that come with that. That's right.
Yeah.
I mean, they don't all have to be joggers
no.
by any means. You know, it's just get them to be active. It'll help the craving. It'll help them with the weight that sometimes comes with the quitting of smoking. So has a lot of benefits.
Yeah, it sounds like it. And to trade one habit for another one, so to quit smoking into maybe walking every day or you know, something on that line, that would be
Something healthy. Yeah, right.
That'd be really great. We want to talk, you know, it was the hardest thing that I ever did was quit smoking. And of course I had a motivator because I was pregnant. And that was a really great motivator. I had been smoking since I was 17 years old, but then back then everyone did it. And we didn't know how bad it really was for us. But we kind of want to talk about how you help, you know, the women quit smoking, the benefits of, you know, the studies that you're doing with the University of Minnesota. And so if you could talk about that a little bit.
Sure. Well, we also we have some studies going right now. One is directed to postmenopausal women who are either given a choice, well, they're randomized, they're not given a choice, they're randomized to either a relaxation program or an exercise program to quit smoking. And they also are given Chantix. I'm sure a lot of your listeners out there have heard about Chantix.
Okay.
It is a new drug on the market. Well, it's been out about 3 years.
Okay.
And it's a very effective drug. It's 2 to 4 times more effective than some of the other products. And it takes away kind of that desire to smoke. It works in the brain, and it works on the receptors, and it just takes some of that desire, or that edge.
Yeah.
So we do give the women Chantix during this study, as well as we have them do an exercise program or a relaxation program.
Okay.
And then we also have counseling for them. And the counseling is really a key component to getting people to quit smoking.
Okay.
The studies really show that it increases the abstinence rate, and it gives the subjects a chance to kind of learn coping skills.
Okay.
And to kind of how to deal with relapse, and how to deal with all the side effects.
Yeah.
So we provide a lot of different things with the study.
Okay, so the nicotine patch, things like that, is that also something that you do in your research too as well, or?
Not right currently, but we did. We did a lot of work with the nicotine patch. Interestingly enough, the nicotine replacement products are not as effective in women as they are in men.
Oh.
Some of the studies have shown that. And part of the reason for that is that women respond more to the psychological cues of smoking, like the cup of coffee, or the time of day, or sitting with the newspaper, or being on the phone, or whatever. They seem to respond more to that in terms of their need to smoke, or their relapse.
Their environment, like when their other friends are out having a glass of wine or something on that line, and then their friends are smoking, and it seems like, oh yeah, they just pick up a cigarette. And, well,
those social cues are the women are much more sensitive to that. And so we try to work with that in terms of the counseling when we help women quit. I wouldn't say that nicotine products don't work. They do, for women and for men. But some of the research shows that it may be more effective for men than for women. But I wouldn't say not to use it, because it does help with the craving also.
Yes. And that addiction that you have to the nicotine as well is so hard to break. So in regards to the actual exercise, you're saying you're recommending that for both male and female, or does your findings better that it's helping the women more, maybe just to go on the treadmill, go for a walk outside, not that you have to go and lift weights and become, a workout guru.
It helps both men and women, exercise does. We happen to be focusing on women because we're also looking at the bone health, and but it helps men too, and the early studies have shown that craving is what it seems to help with. And of course, particularly for women, it helps keep some of that weight down, and just makes them feel good. Just kind of helps relieve some of that stress that you get when you're trying to quit.